afternoon to all and Andarki Namaskaram. So as Chandu Tota was just mentioning, I would be the culprit of making you a lunch delayed. Pedalu, Ravindra Rao garu, chairman of this prestigious Yashoda hospitals. అదేవిధంగా ఈరోజు ఇక్కడికి ఇచ్చేసిన నాతో పాటు మా సహచర గౌరవ శాసనసభ్యులు గాంధీ గారికి, and my friend who was instrumental to get a Telangana one more jewel in terms of Google Maps and also in terms of Google engineering services in the recent past. Mr. Chandu Tota from the Google team and Dr. Michael Hobel, అదేవిధంగా ధీరజ్ గారికి, ఆర్ చంద్రశేఖర్ గారు, my colleague Mr. Sai, last but not the least, a man who was persistent and insisted me to come here, Dr. Chinnababu, and special thanks to the Yashoda hospitals and all the global healthcare leaders who are here, and all the eminent luminaries of technology. I can see Satyanarayan garu, Narayanan garu, and many more, the leaders and the change makers who have come and who had come to share their thoughts in this field of healthcare and technology. I just learned that how an engineer can bring a revolution in healthcare. I was just mentioning, I was just asking Ravindra Rao garu how he had entered into the medical field. He was just narrating a story, how his brother was into this medicine. By profession, Ravindra Rao garu was an engineer. See the turn of the events, how technology is also playing a very key role and critical role in shaping up the tomorrow's Medicare. The cutting edge technologies of today, either it may be AI, cyber security, data analytics, and tomorrow's quantum computing. This is all what I was just hearing to Mr. Chandu Tota. What is moonshots? Yes, here the grand presence of all eminent personalities and the change makers over here. They are all here to make a change in terms of the healthcare. And also, in this intersection of the healthcare and the technology here, what Chinnababu garu was contemplating. I was just mentioning, I was going through this Yashoda hospital is one of our jewels in the healthcare industry. I can say out of the 5 or 6 unicorns we have, Yashoda hospital is also one of the unicorns. And thanks to the management team of healthcare specialists of Yashoda hospitals who always strive for the new things and also yielding for innovation, and they are looking out for the future. One thing is quite clear here, world is changing very, very fast, and healthcare needs to be keeping up with the fastness and the pace. As we see now, when the Yashoda hospital has started in Somajiguda, it may be a small hospital, but the city was also very, very small.
35 years back, 20-bedded hospital.
20-bedded hospital with 30 doctors.
20-bedded hospital, 2-3 doctors.
2-3 doctors. I think the diseases were not so many. And city was also too small. As cities are expanding, the life changes are changing, the climate change is also a bitter concern for us, making many of us unhealthy. We have seen the chronic diseases like heart problems, the cancer, the diabetes, infections like TB are rising fast and killing millions. And one more thing we have to realize is, and truth is we can't ignore, the world is aging. People are living longer. The average age has increased. But hospitals are also thriving because we are not living healthier. In the coming decades, we will see more elderly people living with long-term poor health conditions. India, as everybody knows, now we would like to convert the bane into boon of our demographic profile as we quarter the 1/4 of the global population, and the responsibility in all verticals of our governance lies that we have to see this 1/4 of the global population is healthy, is more agile, and that's how we have too much of pressure in terms of our medical care first. And massive pressure on hospitals and also doctors and healthcare professionals. As we have noticed, the demand for medicines, hospitals and the trained healthcare professionals will grow multifold in times to come. And we can't fight this future with acutes alone. We must invest now, as you rightly said, in innovation, in research, in preventive healthcare. As I know and I've seen it, because in healthcare we cannot be reactive. We must stay 10 steps ahead, relentlessly proactive. We need bold ideas, we need lightning speed, and we must build the scale the future demands. And everybody knows it is a decade of cutting edge science and technology, bleeding edge innovation, and next generation research and discovery. And as WHO benchmark says that for every 1,000 we need one doctor. But we are ahead. I would like to proudly claim, maybe the critics or the negative minded individuals in some sorts, they may mention that India is far behind in healthcare. India has a meaningful progress over the past 70 years with one doctor for every 834 patients. But still we have to build. We have to build, and that lays lots of stress and responsibility on us. We are building healthcare systems that are both affordable and also world class. The next decade I would like to mention here is demands healthcare twice the size of what we have today. You know, we are here now, right now. I would like to mention that what if all the doctors over here or the eminent personalities from this profession are here? What if we see our next door doctor is not a person, but a machine? It's already there. Most of the people would have known. In Saudi Arabia, there is a AI-powered clinic opened in AI Hasa. The system is called Dr. Hua. It consults patients, it analyzes vitals, and drafts treatment plans reviewed by the human doctors. But lastly, a human doctor is also involved, but it is a reality now. A machine can run a clinic And we are seeing and witnessing that